Good morning. Thank you for joining us today for this update on COVID-19 in Pennsylvania. Currently, 5,905 individuals are hospitalized due to COVID-19 in Pennsylvania as of 7 a.m. this morning. 1,145 of those patients are in the intensive care unit, and 747 of those patients are on a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by 5,600 since the end of September. Our hospitals and our health systems in Pennsylvania do continue to be significantly challenged with COVID-19. Today, we are reporting 3,779 new cases, as well as 4,884 new cases on Sunday. This brings the total number of COVID-19 cases in Pennsylvania to 613,804. Of our total cases, the number of individuals who have recovered from COVID-19 is now at 64%. And this number has started to increase again over the last week or more. Tragically, 76 new deaths were reported today, and 127 new deaths were reported on Sunday. And this brings our total to 15,086 people who have died due to COVID-19 in Pennsylvania since the beginning of the pandemic. The statewide percent positivity, as reported on the early warning monitoring dashboard, is now 15.1% statewide. This continues to represent a slight decrease from the week before. Throughout the pandemic, there have been 57,163 cases of COVID-19 among children 5 to 18 years of age. That is an increase of 12,873 COVID-19 cases within that age group in the last week alone. As you know, today starts the Federal Pharmacy Partnership to vaccinate residents and staff of long-term care facilities. Walgreens and CVS are the two pharmacy partners selected by the federal government. CVS and Walgreens have vaccine leads that are reaching out to the assigned contacts at each facility. These points of contact coordinate information such as setting the date, receiving additional information on bed count, employee count, and coordinating patient consent. In the first weeks, the partnership will be vaccinating residents and staff in skilled nursing facilities, often what we call nursing homes. It will then move to vaccinate other long-term care facilities, such as personal care homes, assisted living facilities, residential treatment facilities for adults, and private intermediate care facilities for individuals with developmental disabilities. This week, CVS will be vaccinating residents and staff of 120 skilled nursing facilities throughout Pennsylvania. Walgreens will be vaccinating 6 patients and staff in skilled nursing facilities in Pennsylvania. CVS and Walgreens and Operation Warp Speed from the federal government, they select the locations and they will deliver the vaccine and conduct the vaccination clinics. The residents and staff will be receiving the Pfizer-BioNTech vaccine. Now, it's important for me to emphasize that this is really the federal government's program. The federal government has required facilities to opt into the partnership, and we have worked to opt in all eligible facilities. The pharmacies will be reporting how many vaccinations they have administered, but we don't know exactly how quickly that information will be available, but it will be at least 72 hours after the vaccine administration. Now, as I've been saying before, the Philadelphia Department of Public Health is receiving its own allocations of vaccines, and they are operating separately than the efforts of our department, although we do speak frequently and collaborate. As of this morning, hospitals have vaccinated 72,762 healthcare workers with either the Pfizer or Moderna vaccines. This will continue with vaccination of healthcare workers. This week, 58 hospitals are slated to receive 47,775 doses of the Pfizer vaccine and 26,100 doses of the Moderna vaccine. And the number of those doses is determined by Operation Warp Speed in the federal government. We are working to update our interim vaccine plan to align with the latest prioritization recommendations from the CDC's ACIP, or Advisory Committee on Immunization Practice, and the recommendations that were released last week. These recommendations did make some changes to the categories of people vaccinated, particularly in Phase 1B, and they actually added a Phase 1C. So we'll be working to make those updates. What is still clear is that this vaccination process will take some time, and it's particularly dependent upon how much vaccine we receive each week from the federal government. In the meantime, our current mitigation efforts are as more important than ever. It is still critically important to wear a mask, wash your hands, social distance. It's very important to avoid large gatherings and small gatherings. And as we approach New Year's Eve and New Year's Day, we cannot let our guard down. We must stay the course and continue to work together and stand united to stop the spread of COVID-19. And now I'm very pleased to answer questions.
Thank you, Secretary. Our first question is from Paul Go from the Pittsburgh Business Times. Go ahead, Paul.
The first question I have would be about, we're about a week away from the end of the scheduled temporary pause. Where do we stand right now? Obviously, there's a lower case numbers over the weekend, and there has been that plateau you've talked about. But what are some of these indicators? And also, if you had to make a decision this week, I mean, where would we be, just so we get a sense of what you're looking at?
Well, so we'll be having those discussions with the governor's office and making our recommendations, obviously, this week in preparation for January 4th.
And one other, so you don't have any sense of where you are right now with that?
We will let you know.
And the second question is, you said Walgreens had 6 nursing homes that they were working with. Was that this, and CVS was 125? Is there a reason for that?
CVS had 120. That is how they're working it out with the federal government. So again, we have no particular influence in terms of that. So that's this week's numbers that we get from the federal government, and CVS and Walgreens lets us know.
Next up is Flora Pastorero with PennWatch. Go ahead, Flora.
Yes, good morning, Secretary. Just to follow up with what Paul was saying, that the numbers have gone down significantly. So would there be the possibility of lifting the mitigation efforts early to allow the restaurants to go with indoor dining for the New Year's Eve holiday, and to allow gyms to open before next Monday?
No, we're not going to be changing our mitigation orders, but we will be discussing what the plan will be on January 4th. But there is no plan to change things for this week. It's critically important during the holiday weeks, as we approach New Year's, for people to continue, as I've said, to continue their mitigation efforts, to continue to avoid large and small gatherings, and really not to get together in gatherings over New Year's Eve and New Year's Day, because that could still significantly spread the virus. As Dr. Fauci has been talking about, public health authorities are concerned about travel during the holidays and these gatherings, and we want to make sure that the current plateau and maybe even decrease that we're seeing continues in the new year.
And what is the situation with hospitals? Have you received any reports from any hospitals around the state that they've run out of ICU beds?
So we get reports every day from hospitals, and right now, hospitals are challenged at various parts of the state, but they are making necessary accommodations. So they might be postponing certain elective procedures, or they're making whatever accommodations are necessary to deal with COVID-19 patients, and of course, acute non-COVID-19 patients. So right now, the hospitals are stable, but they have been challenged.
Next up is Royce Jones from KDKA. Go ahead, Royce.
Thank you, Dr. Levine. Sunday, Dr. Fauci said the nation could see a surge on top of a surge following Christmas gatherings and holiday travel. Can you explain what this could look like in the state of Pennsylvania, and when and if we could expect this to hit our state?
So right now, as we've been discussing, we have seen a plateau and then even a slight decrease in terms of the number of new cases. Now, of course, this weekend's numbers and today's numbers are certainly influenced by decreased testing, of course, over Christmas and the weekend. But we have been seeing that plateau and slight decrease. Those are very positive findings. But we are concerned that we could see an increase again in January if people do not stay the course, as I've been saying. If they travel a lot, if they participate in these type of gatherings, then we could see an increase again in January. And so that's what we're watching for, but that's what we're really why we're putting out the message over and over again to avoid travel now, avoid these gatherings so that we can continue to see positive decreases in January.
And I know you just mentioned you're going to continue communicating with the governor's office for January 4th and what happens next. But if we do have another surge come January, could we expect further restrictions? Is this something that you guys have been talking about?
I can't predict the future. We're trying to prevent that surge in January in the first place. So that's what we're concentrating on right now.
Next up is Bill Kibler from the Altoona Mirror. Go ahead, Bill.
Thank you. Will the names of the nursing homes that are getting vaccines today be available today?
And we'll have a dashboard available tomorrow.
Okay, thank you.
Next up is Jamie Bittner from Fox 43. Go ahead, Jamie.
Hi there, Dr. Levine. I actually have two different questions for if you don't mind. I wanted to ask you about the vaccine rollout as it stands right now. I know that you had said, was it around 72,000 healthcare workers had been vaccinated? I remember in the first week of the rollout, there was around 97,500 vaccines rolled out. And you had said that the vaccines were arriving later, but are there other reasons why the administration of these vaccines isn't keeping up with how many doses is coming into Pennsylvania? Is a lack of manpower as well at some of these places?
That it continues to be that you tend to think that they all come out on like all last Monday, but they don't. They come out as the week progresses, and then of course there was Christmas, and so significantly decreased number of vaccinations in Christmas. But vaccine will be coming out this week again, as I mentioned. Again, that doesn't all come out on Monday; it'll come out through Thursday, and vaccinations will continue all week.
Okay. And can I ask one more question about businesses opening past January 4th? What kind of data would you could be looking at to see if that would change that date of January 4th, whether it be open beforehand or afterwards? Can you go in a little more detail about how you're making those decisions so that these business owners have a little bit more concrete answers onto if there might even be a chance that they could open earlier?
So we are looking at the same type of data that we've looked at throughout the pandemic. So we look at the number of new cases and particularly the incidence rate, which is the number of new cases per 100,000. We look at that statewide, but we also look at that particularly in regions and in counties. And then we look at the percent positivity rates, and we discuss all that data, and we'll make our recommendation to the governor, and the governor will make his decision.
Next up is Sarah Satullo from Lehigh Valley Live. Go ahead, Sarah. Go ahead, Sarah.
Hi, Secretary. Can you hear me? Thanks for taking my question today. So obviously we're seeing some decline in the testing from, as you said, the lag over the holiday weekend. But could you speak a little bit more about the trend that you were seeing in the data before the holiday and why you think those trends were encouraging?
Well, so we have been seeing certainly a plateau, maybe a slight decrease in the number of new cases, as well as a decrease in the percent positivity. I think that what we're following is some of the national trends, so that occurred a month or more ago in the Midwest, and it is starting to occur in the Mid-Atlantic area. So, we're following the patterns of many other states in our area, Ohio, West Virginia, Delaware, Maryland, etc. But also, I think that it is the impact of the series of mitigation measures that the governor and I put into place in December. So I think it is a combination of the national trends and the mitigation orders that were put in place, and I think that they are working and our numbers have decreased.
Thank you.
Next up is Robin Hearn. Robin, go ahead and unmute yourself.
I don't have any questions. Thank you.
Okay, after Robin, we have Tom Ford from the borough. Go ahead, Tom. Tom also passes. Okay, next up is Samantha Rulin from the York Daily Record. Go ahead, Sam.
Hi, Dr. Levine. Thank you for taking my question. I was just wondering if there have been any, with hospitals getting the vaccines, if there have been any complications or if any of the doctors or nurses who've already received the vaccine, if they've reported any complications kind of now that it's been some time since those first doses went out.
Well, thank you for that question. We have had no reports of complications or any reactions in Pennsylvania.
Great, thank you very much.
Next up is Patrick Abdullah from the Keystone.
Thanks for taking my question, Dr. Levine. I had a question about, where I live, some of the schools started closing, earlier recently, and where a lot of my relatives live in more rural parts of the state, they stayed open. And I was wondering if there's at all believed to be a connection with that and with some of the higher numbers in some of the rural parts of the state.
That's hard to exactly to determine. So as you've been referring to, the schools have local control, and so we do have guidelines that the Pennsylvania Department of Health and PDE, the Department of Education, have put out about what we would recommend in terms of in-person instruction versus hybrid versus remote instruction. Overall, certainly at the beginning of the fall, the colleges had a dramatic impact upon the local numbers. So the question in terms of the schools, I'll have to look at the data more carefully, and we'll get back to you.
Thank you very much. I appreciate that.
Next up is Nicole Brambilla from LNP. Nicole, go ahead and unmute yourself.
Sorry about that. I think I hit unmute before you guys unmuted me. Thank you for doing this and for taking my question. Could you tell me how many counties, I know the dashboard is going to be up and running tomorrow regarding vaccines availability for skilled nursing homes, but can you tell me how many counties have received vaccines and are inoculating today?
I don't have that information in terms of the skilled nursing facilities. I don't have that at my fingertips. We should have that available tomorrow. Our communications director, April Hutchison, might be able to get back to you with some of that information even later today.
I appreciate that. And one quick question, if you can humor me just a minute here. So this has been kind of frustrating getting this information. I realize that Operation Warp Speed is playing lead on this. When I reached out to CVS and Walgreens, they referred me to Department of Health. when I referred to your folks there at the Department of Health, you referred me to Warp Speed. When I reached out to CDC, they referred me back to the Department of Health. Do you know why this is kind of a circular loop and nobody's got the information about the number of doses and which counties are receiving vaccines?
Well, so again, we only received the information from Operation Warp Speed over the weekend in terms of which skilled nursing facilities were receiving the vaccines today. So we'll, as we put up our numbers and our dashboards, we're going to try to be absolutely as transparent as possible in terms of, I mean, we'll have up this afternoon which facilities are receiving it. So we're going to try to be as transparent as we possibly can. I think the dashboard will help a lot. It'll be up tomorrow.
Next up is Brett Schultes from WITF. Go ahead, Brett.
Good morning, Dr. Levine, and thank you for your time. I have a question not about the death numbers or just the case numbers. I'm kind of curious to know what is the most recent information you have on long-term effects or longer-term lingering effects of COVID-19 among people who do survive. We've heard everything from heart and lung damage to mental health issues. And are some of those instances of people who have further complications being represented in the hospital data that we see? So can you speak to just remind people what you know about those complications that are possible and how that's also affecting health systems and hospitals?
Sure. So certainly our medical care has improved a lot, as we've discussed, and we have many more treatments, such as the monoclonal antibodies, as well as remdesivir and dexamethasone. So the length of stay has gone down, but there are patients that are known as long haulers, those that have chronic symptoms. Most of those patients would not stay in the hospital unless, I guess, their symptoms required hospital care. I think the main concern with those patients are chronic symptoms, and they're at home and receiving medical care, but not hospitalization care or intensive care. I don't really have any new information about the long haulers. We can see if there's any new national information that we can provide for you. But I think it would be unlikely for most of those patients who are having symptoms for weeks and weeks and months to still be in the hospital. I think that they're working through it with their healthcare providers at home.
Thank you.
Next up is Davine Quartz from the Beaver County Times. Go ahead, Davine.
Hi, thanks for taking my question today, Dr. Levine. I wanted to kind of just revisit a little bit with the businesses that aren't listening to your mitigation. One, what would you say to the folks who are still going out to restaurants that are defying orders to try and convince them that this is not the right choice? And additionally, what is the next step in enforcement for these places that are ignoring citations from their health departments in the state and are remaining open and serving people in-house?
Well, last week there were a number of injunctions against those facilities, ordering them to close. What I would say to the facilities and the patrons of those facilities is that I worry for their health. I think that they are exposing themselves, their families, their loved ones, the staff at the facilities to continue to stay open, to continue to go against the orders, and they're putting their community at risk for continuing the spread of COVID-19. And so, we know, as was talked about, the long haulers and the hospitalization rate, we know how severe this virus can be. And so it's really important that we stand together, that we stand united, and that we stay the course in terms of these mitigation orders so that we can continue to limit the spread, continue to have more positive numbers, and then we will take positive action. So I would ask them to close and not continue to bring people into those facilities when it's not safe to do so.
And this, I don't know if you'll have an answer to this or not, because this may be more the governor's, but are there plans for additional rounds and additional checks for New Year's Eve, being that I know even though you guys closed or restricted alcohol serving on the night before Thanksgiving, there were still many, many bars that opted to still have patrons and serve patrons through the evening. Will there be additional enforcement going on New Year's Eve?
I mean, I can't really talk about enforcement. I'm sure there might be officers out checking, but over New Year's Eve, those facilities are supposed to be closed. And so restaurants are closed, bars are closed, nightclubs are closed, casinos are closed. And so, when we did the order in terms of alcohol over Thanksgiving, they could be open at 25 to 50%. So right now, over New Year's, they are closed. So any patrons in those facilities would be a violation of the order. And, law enforcement, I'm sure, will be out.
Next up is Erin McCarthy from the Philadelphia Inquirer. Go ahead, Erin.
Hi, Dr. Levine. Thank you for taking the time to chat with us today. You talked last week about how important it's going to be for home healthcare providers to get vaccinated in this first priority round, which we're currently in. Do you have any updates on what those type of professionals should do to make sure they get the vaccine?
We'll be having a further update about that, and we're working on our plans. We'll have an update later this week.
And regarding the rollout at skilled nursing facilities and then later other care facilities, I know it's federally organized, but I was wondering if you knew how the distribution would work, assuming it's all voluntary under the EUA. Do you know if most residents and staff are opting to get the vaccine, and how does that work for residents who may have dementia or Alzheimer's?
So yes, we are expecting that the vast majority of patients and staff will be opting in and receiving the vaccinations. So like any other medical procedure or shot, etc., if a patient cannot give consent for themselves, then their guardian will need to, a loved one will need to be able to give consent. And so Walgreens and CVS, working with the facilities, are working on those consents.
Next up is Boris from the Scranton Times-Tribune. Go ahead, Boris. Boris, go ahead and unmute yourself.
Here, I'm sorry. I'm wondering if you've given any thought to how quickly the vaccines will roll out in the new year, and when we might see some easing of all the restrictions in the new year.
Sure. So I can't speak to, the easing of the restrictions. We'll see how our numbers go. Again, we will have an announcement by January 4th about those mitigation orders. And we anticipate that there'll be consistent weekly distributions of the vaccine in both parts of 1A. So that includes the healthcare workers, and it includes the staff and the patients in these long-term care living facilities. We can't comment, I can't comment upon how much vaccine we're going to get. We receive that information from Operation Warp Speed by the end of the week. We do know that all the people who've been immunized, they do put aside for us the exact same number of shots so that, and so everyone can get their second shot. So that's for the Pfizer vaccine after 3 weeks, and the Moderna vaccine after 4 weeks. But in terms of new patient vaccinations, we learn on a weekly basis about exactly how much we're going to get. It's, as we've talked about before, it is going to take months to roll out this. I mean, if you look at the number of patients, a number of individuals that are part of 1A in Pennsylvania, it's probably 1 million or more people. That's going to take time in terms of that immunization. Then there's 1B, and now a new category 1C that will be immunized. And then phase 2 is the general public. I can't exactly say when we'll be getting to the general public. What we've said before, that we're hopeful for maybe late spring, certainly by early summer, that the general public will be able to receive vaccinations.
Boris, any follow-up?
I'm good, thank you.
Okay, and our last question is from Hannah Brandt from ABC 27. Go ahead, Hannah.
Hi, yeah, thanks for taking my question. So obviously now we have the addition of the Moderna vaccine. Are we anticipating other vaccines being approved? How much would that speed up our process? And how much does the Moderna vaccine kind of speed up the process to get everyone vaccinated? I know you can't predict, and hopefully we'll get there by spring, but kind of what are you anticipating on that front?
The more vaccines, the better, but we can't put a date in terms of science. So there are 2 more vaccines that are either completing or just have completed their clinical trials. That's the AstraZeneca vaccine and the Johnson & Johnson vaccine. AstraZeneca will be being looked at by the FDA, and when Johnson & Johnson finishes its clinical trials, then they will apply for their EUA under the FDA, and we'll see what the science shows us. There are 2 more vaccines in the pipeline, and I just saw a report that one of them is going to start its clinical trials soon. So can't tell exactly how long that will take, but probably 3, 4, potentially 6 months, and we'll see how it goes. The more vaccines we have that are deemed safe and effective and available for an EUA from the Federal Drug Administration, the better, and that will certainly speed up the process. But right now, it is really absolutely wonderful that we have 2 safe and effective vaccines.
Thank you, Secretary. That concludes today's briefing. A copy of this briefing will be available on PACast.com. Thank you.